In this video, I would like to talk about the differential diagnosis of heart palpitations and how should you approach a patient with heart palpitations as a medical intern or as a medical student. So what are heart palpitations? So a heart palpitation is when the patient is actually aware of the unpleasant sensation of their heart beating, whether this being a forceful heartbeat, irregular heartbeat, fast heartbeat, slow heartbeat, whatever it is. If the patient feels it and it's an unpleasant sensation, then it's considered heart palpitations. Now, sometimes this could be normal. So if you go on a run, for example, sometimes if you're lying very relaxed in bed before you go to bed, sometimes feel your heart beating as well, this could be normal. But in most of the cases, you should take this complaint seriously because it could be something that is life-threatening. So before we start, I think it would be a good idea to briefly mention the normal cardiac electrical conduction system. So what happens is you have the SA node, and a signal is generated in the SA node, and this signal moves down the atria, and then all of these signals go through the AV node. So you actually do not have any direct communication between the atria and the ventricles except through the AV node. So everything has to go through the AV node first, and then from the AV node it goes to the bundle of His and the bundle branches, and eventually to the Purkinje fibers. And then you get a simultaneous contraction of the heart. Between the atria and the ventricles, there is some form of electrical isolation layer where the electrical signal cannot go from the atria to the ventricles without going through the AV node. If it does, then you have a cardiac issue. In this video, I assume that you know the basics of ECG, but I will go very briefly over the most important parts. So a normal ECG will have a P wave that has a specific morphology. Each P wave is followed by the QRS complex, which you see here, and then you have a T wave and you have a U wave sometimes. Depends on the patient. It's not always there, but it can be. When you look at the ECG, you need to check the rate, you need to check the rhythm, and you need to check a lot of other things. But here I'll mention things that are related to heart palpitations. So one of the things you need to look at is the morphology of the P wave, and the P wave gives you tells you something about atrial T polarization. Then you have to look at the QRS complex, and in particular you need to look at the morphology and the width of the QRS complex, because if it's more than 120 milliseconds, and that's around 3 boxes, it's considered to be abnormal. And if you have a wide QRS complex, that gives you a different differential diagnosis than if you have a narrow QRS complex. Each small box, so you have these large boxes, right? Now each large box has 5 small boxes inside of it, and each small box is 1 millimeter. Now a very quick way to look at the heart rate is to look at these large boxes. So what you do is you try to find a QRS that overlaps with one of these large boxes. So let's say a QRS complex. So if we look at this one, for example, it's close to one of these large boxes, right? And then you try and find the distance between two QRS complexes, what's referred to as the RR interval. So you look at the R wave, which is this one, and then the R wave, which is this one, and look at the RR interval, right? And then you try to figure out where are they located in relation to each other. So if you have the RR intervals that are placed only one box away from each other, so if you have one QRS complex here and another one here, that means the heart rate is about 300 beats per minute, as you can see here. If you have 2 large boxes between them, it's about 150. If you have 3, you have 100. If you have 4, you have 75, and so on. The RR interval is relevant and important because it tells you a lot. It tells you something about the rhythm of the heart, whether it's regular or irregular. QRS complex, it's ventricle depolarization, and the T wave tells you the ventricle repolarization. Tachyarrhythmia or tachycardia is when you have a heartbeat or heart rate that is more than 100 beats per minute. Normal heart rate is between 60 to 100 beats per minute, and here I'm talking about adults, not children. Now I want to discuss a general framework if a patient comes to the clinic with palpitations. Now, of course, the setting is very different, so it depends on where do you see the patient, and where do they come from, and why are they here. But it's really important to have a general framework for palpitations. The first thing you want to look at if the patient comes complaining of palpitations is to look at whether the patient is stable or unstable. So if the patient is unstable, and this you can determine based on the vitals of the patient, so blood pressure, if they are hypotensive, also neurological signs like if they are in syncope, for example, or things like this, then the patient is unstable and you might need to do cardioversion. In this case, usually the diagnosis is not as relevant. What you need to do is save the patient, right? If the patient is stable, then you can do an ECG, and the ECG will tell you one of two things. Simply, it will either be normal or abnormal. Now keep in mind, just because the ECG is normal does not exclude a cardiac cause for the issue of the patient, because you could have just conducted the ECG when the patient did not have any complaints, because a lot of these diseases can be paroxysmal or intermittent, so they can come and go, and by chance you just performed an ECG when the patient did not have these symptoms going on. So just because the ECG says it's normal, it does not necessarily mean it is normal. Now if the ECG is normal, you have one of two causes. It's either a non-cardiac cause, and this includes a huge list, but some of the important things in the list include endocrine diseases. Something like hyperthyroidism, for example, will cause palpitations. If you have electrolytes imbalance, if the patient uses stimulants or drugs, so something like alcohol or caffeine or cocaine, or for example stopping beta blockers can cause palpitations. And you have psychiatric causes. Anxiety attacks, for example, can cause palpitations. Now if the ECG is normal and you still have high suspicion of that the cause is cardiac because of the patient history or the family history, or for whatever reason, or you just want to be extra sure, you can consider extended ECG, where you do Holter ECG monitoring, for example, for 24 hours, or you do event monitoring for a longer periods of time. Now, if the ECG is abnormal, you want to look at one of two things. Does the patient have tachycardia, or is it something else? Okay. If the patient has tachycardia, which is heartbeat more than 100 beats per minute, you want to look at two things, and these two things will give you a good differential diagnosis. The first is you want to look at the rhythm. Is the rhythm normal? And as I said, if you want to look at the rhythm, you look at the RR interval, so the distance between the QRS complexes. And if they are always the same, even though the heart is beating very fast, then you can say actually the rhythm is regular. If they are not the same and you can't really predict what's going on, so sometimes they're very short, sometimes they're larger, then you have an irregular rhythm. Now you can just look at the QRS complex and you want to see if it's wide or narrow. Now we said wide if it's larger than 120 milliseconds. This is about 3 small boxes. Now if you have a regular rhythm and you have a narrow QRS complex, then think of 3 things. It's either sinus tachycardia, or supraventricular tachycardia, or atrial flutter. Actually, atrial flutter is type of supraventricular tachycardia. So you can think of these main 3 things, and we will discuss them a little bit more in depth later on. If you have a wide QRS complex, you can think of ventricular tachycardia, but the rhythm is regular. Now, if the rhythm is irregular, you have a different differential, and the QRS, you look at the QRS complex. If it's narrow, then think of atrial fibrillation and think of multi-atrial tachycardia, and we will discuss this later on. And if the QRS complex is wide, then think of ventricular fibrillation. In this case, usually the patient is actually unstable. Now you can have also other abnormalities like premature beat, structural abnormality that you can spot on the ECG, or Brugada syndrome. You can also have here Wolff-Parkinson-White syndrome as well. So this is a very general framework for what to think about. Now this is these are the main kind of like diseases. You can also have other diseases which I'll touch upon. At the end of this video, I will also address what kind of things to take into consideration when a patient comes in. I just opted to do this later on after I explained the diseases a little bit,